Actor Luke Perry passed away from a stroke at the age of 52, and director John Singleton, 51. So I posed the question to stroke expert Dr. Italo Iinfante. I asked, how does age affect our risk of stroke? Here's what he had to say.
But I think, honestly, there is this entity called stroke in the young. So of course, as you get older, there's a more likely chance to having a stroke or a heart attack, but also young patients do. And particularly if you have risk factor. I don't know the unfortunately story of these two gentlemen, what were the risk factors and what happened to them, I don't know, but no, we see them happen. The good things about having a stroke in a young person that you can, usually their outcomes are better once they're properly treated and they recover much faster compared to someone who's older. And we know, for instance, in ischemic stroke, if you have an area of the brain damaged, someone who's younger can recover from a large area of the brain damage compared to someone who's older. So there's some good things, but easy. Stroke in the young, so-called stroke in the young, is an entity that we need to be aware of.
Just out of curiosity, doctor, what's the youngest age you've treated?
I've treated? Mm-hmm. Oh, I've treated a 6 months old baby.
For a stroke?
Yes, with a ruptured aneurysm. They're very unlikely,
right? But
of course, it's very unlikely in the pediatric population, but of course, we're the youngest I've treated.
Wow. Oh my goodness. All right. Yeah. Switching gears now, stroke can affect people of all ages, as we've been talking about. And we have a video of a patient who suffered from a stroke at the age of 23. Can you imagine, 23 years old? Let's hear her story.
I was working out at the gym. I was in a class, it was a group class, about 10 of us, and it was being guided by a trainer. I got dizzy and he asked me, he said, why did you stop? I told him, because I got dizzy. I raised my arms, except this one went up and this one didn't. Within 10 minutes, the ambulance was there. Within 30 minutes, I was at the hospital.
When the patients come like that, the patient enters like a protocol that we have here at Baptist, like a stroke protocol, which gets like an emergent CT scan, a CTA, which is a CT to look at the blood vessels to identify exactly where the blockage is, and then to see if the patient would be a good candidate for interventional therapies, which would be basically mean that we're going to go up with this plastic tube up to the patient's brain, to the vessel that is blocked, and try to unblock it.
It was very, very scary waking up and not fully feeling the left side of my body, feeling numbness, feeling tingliness.
We were able to diagnose her as having dissection of the vessel, which is a little tear in the inner layer of the blood vessel that actually caused it to block, and that was the cause of it.
This can happen to anyone at any age, no matter what condition you live your life, no matter how healthy you are or unhealthy you are. I'm only 23. It happened while I was working out. When something's gonna happen, it's just gonna happen. I left the hospital feeling great. Today was the first day that I was able to run on the treadmill. That's the fastest I've moved in the last 2 months, and that was amazing. That was 4.2 miles per hour. I'm gonna write it down. I'm gonna write down the date, because that was the most exercise or like cardio exercise that I've done within the last 2 months.
Now remember, if you have a question for Dr. Iinfante, there's the toll-free number. We'd love to hear from you, 855-796-4475. Doctor, once you have a stroke, are you more likely to have another one, or does that have nothing to do with it?
Well, it depends, again, on risk factors. Definitely if you are more risk, if you have one stroke, you're more likely to have another one. But if you go to a properly treated and they control your risk factor, then our job as physicians is to make sure you don't have another one. So if you control risk factors, that's what we typically do.
All right, let's go through now things that can really impact your life, risk factors. Lifestyle really impacts lifestyle, like
absolutely. No smoking, diet and exercise, they're very, very important.
High blood pressure increases your risk of a stroke?
Definitely, high blood pressure is a major silent killer. It used to be called in the old days when they didn't measure blood pressure. And the parameter for blood pressure, normal blood pressure, has been going down over the course of the years. Now we have these magic numbers in 120 over 80, which is everybody should be aimed to. Below that number, the risk of having a stroke is lower.
Let's show the blood pressure ranges for our viewers so they can look at it. I think it's always important to know your numbers, regardless if you have, no hypertension. Doctor, walk us through this real quick. Right,
so like I mentioned before, the new recommendations are systolic blood pressure less than 120 and diastolic less than 80. Is elevated when you are in the minimum range, and then very high blood pressure when you are 130, 140, and 90 or 100 or high.
And then, of course, 140
And
or
of course,
higher.
then once you go higher, then it becomes an emergency. You have to go to the emergency room and treat it immediately.
All right, let's shift now to cholesterol. That's another big one. Talk to me about the cholesterol numbers and why they impact and why they are a risk factor.
So, I mean, of course, the recommendation, as the more we know, they get upgraded, but the newest one, your total cholesterol should be less than 200. And the LDL should be, in patient with risk of stroke, should be less than 70. So, I mean, definitely, I mean, the bottom line, I don't want to throw numbers. Know your numbers, talk to your doctor, and ask them what your numbers are, and I can be treated. I mean, now, the good news, I mean, we're talking about lots of bad news, but the good news that we can treat these things. We can have very effective medication to lower blood pressure, and we have very effective medication to lower cholesterol. So, something.
So if you have that controlled, you have less of a risk
Of course.
of having a stroke, obviously.
Yeah.
To watch the rest of this interview with Dr. Iinfante, where he talks about how they treat strokes in the ER, be sure to download the Health Channel app where you can watch full-length episodes.